Good evening. Please turn your attention to the front of the room as we welcome Dell Medical School's class of 2024.
Welcome, everyone. Isn't it wonderful to all be here together in the same room? I also want to welcome those who are joining us virtually. So obviously we're all comfortable with the hybrid model, and we're following the hybrid model tonight, and we have quite a few people that are joining us on at home or wherever they are. What an honor it is to lead the procession of the unsinkable class of 2024. Please be seated. You all can have a seat. I mean, what a hard year, for everyone, for medicine, for our educators, and especially for our students. So I'm just so thrilled it is over. And here we are at your white coat ceremony, a little delayed from the normal, but even more glorious because of that. The family, friends, and partners are absolutely critical to the success of our students. They wouldn't be here without you all. I mean, parenting is, we know, one of the critical predictors, good parenting for good doctors. So thank you for all your excellent work in getting your student here, and that's going to pay off as they enter the profession. I also want to thank our donors. We have lots of donors, and they're very important to us. A number of them support scholarships that are being received by members of the class of 2024. That's noted in your program. I want to just acknowledge how important that support is to our students. Our tuition isn't very high, but the debt burden living in Austin, it's not so easy. So that's very important support. I also want to recognize our superb medical education team. I mean, we really do have I think we're the best medical education team anywhere in the world, and led by Sue Cox and Beth Nelson, Steve Smith, many others play roles in that, but those three, Joel DeBow, all playing important roles also tonight, but particularly under Sue's leadership, just an amazing team. We wouldn't be here without the Austin community. You know, I think this is an Amber Alert. Don't worry, no tornado or anything out there. So we wouldn't be here without the support of our community, the vote of the community to raise property tax in order to support the med school makes it possible for us to have a medical school here, links us to the community in a really important way. I also want to thank the Travis County Medical Society, and Nancy Foster's representing them tonight as their president, and their board members for all the support that we receive from them through the White Coats. It's a strange and wonderful pleasure to introduce our keynote speaker, Clarissa Johnston. If it isn't apparent to you, it's someone I know quite well. But I had absolutely nothing to do with her being picked tonight. I just want to be clear. I had no knowledge of it until after a decision was made. I had nothing to do. It may have something to do with her, the characteristics of her in her work that were recognized last year in the Compassion and Character Faculty Award, which is awarded by our students, residents, and faculty. I think that does characterize her quite well. So she and I met at the University of California, San Francisco in the romantic VA hospital, but I won't go into any further details about that. And she did her medical school training, also her residency there, and became a hospitalist, internist, palliative care doctor. Unfortunately, sadly, her skills as a palliative care doctor had to be applied to her own family this week. Her stepfather, Joseph Kennedy, who raised her, had Alzheimer's disease and was admitted with complications last Friday and died on Monday. Because of that, she flew out on Wednesday to support her family. I will join her tomorrow with our son. Because of that, her presentation is recorded, which was very disappointing to her. But she is joining us virtually. She said she wasn't going to watch her own presentation because it's too painful, but that she'd watch the introduction and the end. So know that she's here. So I'm thrilled to see this. I'm seeing it for the first time myself as well. So I guess since we know she's online, could you all welcome Clarissa, and we'll see her presentation.
Welcome to Dell Medical School at the University of Texas at Austin, class of 2024. And welcome to the community of physicians that will be your teachers, your mentors, your colleagues, and your learners as well. And not just the community here at Dell Medical School, but the community of medicine, doctors, physicians, nurses, all over this country and all over the world. I am honored to be your speaker today and beyond excited and enthusiastic for you all. The white coat ceremony the purpose is simple. The white coat symbolizes the privileges and responsibilities that you take on when you enter medicine as a physician. And this is a journey that you have already started, starts with the white coat. But starting this journey now with all that has happened in the world in the last year and a half may seem daunting and even foolhardy to some. I want to reassure you that despite all the challenges and the difficulties of the past year, medicine remains the most challenging and rewarding career you could have possibly chosen. As I thought about what to say today, instead of inspiring advice, which I feel like I'm not creative and enough to come up with, so advice like wear sunscreen, make your bed, wash your hair, brush your teeth. Instead, I am going to tell you some experiences and stories from the past year and a half. And these are things that have deepened my commitment to medicine as a career and just remind me how rewarding medicine has been to me. And I hope they can affirm your decision to choose medicine. The COVID-19 pandemic has been described as unprecedented. But really, we have been facing epidemics and pandemics in medicine and in history throughout time. The most recent epidemic before COVID-19 is something I think a lot of us have really forgotten about, but I am old enough to have experienced it, which is the AIDS epidemic in the 1980s and the 1990s. We forget about it because AIDS now is such a treatable illness. Most people with AIDS are able to live a normal life and have a normal lifespan. But we forget that in the 1980s and 1990s, AIDS was a horrible, stigmatizing diagnosis, and we had absolutely no treatments for it. I want to just quote one of my mentors, Dr. Molly Cook, who's an amazing internist in San Francisco. And she recently was interviewed about the early days of AIDS. And what she said was, in the early years of AIDS, when there was virtually nothing physicians could do to save their patients' lives, how dark it was. People who came to medicine after 1996 cannot fathom how bleak it was. When I started medical school in 1991 in San Francisco, I had many people and practicing physicians tell me that I was crazy to go to medical school in San Francisco. We had no effective treatments. People died young and really painful deaths. When I was an intern, my first year after finishing medical school, 50% of my patients had AIDS. And again, we had no effective treatments. People died painful deaths, and they often were young people dying, and they were vulnerable and often rejected by their families and would die alone. The very first patient that I admitted when I was an intern, when I finished my medical school and started my training, is someone that I will never forget. He was a young man who came into the emergency department at San Francisco General complaining of shortness of breath. It was very obvious to everyone, all the doctors and nurses, that he had AIDS. However, when I talked to him, he denied having AIDS, knowing that he had AIDS, and told me that he had been tested for AIDS a month before and was negative. This was in between gasps for breath. He also told me that he did not have any family that he wanted me to contact, would not give me any family or friends' names. I will never forget the shame that this patient felt having AIDS. He ended up having a pneumonia caused by AIDS, and he died alone 3 days later. The medical community learned many lessons from AIDS that we have been able to apply to COVID-19, including the importance of acting quickly during an epidemic and in making the pipeline for research and treatments be faster, quicker, getting to the patients who need them. We've also learned to be transparent to our patients and communities about what science is doing in terms of research. And we've also learned how to avoid stigmatizing our patients, especially our more vulnerable and disenfranchised patients. By the last year of my residency, so 3 years after I admitted that patient, only 10% of my patients had AIDS. And that was because we had developed protease inhibitors and other effective treatments for AIDS. The change was nothing short of a remarkable miracle. It was really impressive. All of these lessons from AIDS have been really helpful in developing treatments and thinking about how we treat COVID-19 and how we have dealt with this pandemic. But really, how can you ever be ready for what has happened in the last year and a half? The physical, emotional impact of COVID-19 has been profound. As a practicing hospitalist and palliative care physician, I think back to this time last year. We were in the middle of our first surge, our COVID surge in Austin. We had so many patients who were sick in the hospital. We were bursting at the seams, particularly in the ICU. Our patients were really, really sick. Every day we were intubating many patients, putting them on mechanical ventilators to help their lungs to see if they could recover from COVID-19. We were also trying to figure out what treatments would work. We ended up discovering that steroids do work and discovering that other treatments like hydroxychloroquine didn't work. Dealing with the fear of our patients, their families, and frankly, our own fears was really daunting. I have a distinct memory of every day driving to the hospital. I come up east on 15th Street and I would make a right-hand turn on Red River and go into the physician parking lot. And as I make the turn and I look up, I can see the sky bridge that connects the parking lot to the hospital. And I would look up and I would be afraid. I was afraid to go into work. I would think, is this the day that I'm going to get COVID? Is this a day that my respirator mask that I wear that makes me look like Darth Vader is going to have a break in the seal and I'm going to get COVID? And I might be one of the people that gets really sick with COVID. And maybe I'll be one of the people that dies with COVID. But I would park my car and walk across the sky bridge, getting my screening, and I would enter into the community in the hospital, and I would see my fellow physicians, our amazing residents. I would see the so brave nurses and so brave respiratory therapists, our amazing environmental service workers who would clean patients' rooms when they got better and got to go home, and also clean the rooms of the patients who died and didn't make it. The biggest challenge of COVID looking back was not treating patients and figuring out what treatments to do. That was challenging. But the biggest challenge of all, I think, was, at least for me, was the barriers we faced. And I mean the physical barriers. So I'm sure you've seen photos of what everybody looks like when they take care of COVID patients. We have that big Darth Vader mask on, a face shield, a cap, the gown, 2 layers of gloves. We lost our ability to really touch patients. We couldn't talk to our patients who were on ventilators. And also, we spend a lot of time with our patients' families, especially when patients are sick and can't communicate with us. We talk with patients' families, and we lost all of that. There were no visitors allowed, and families, we could only talk to them and update them on the phone. We did some things to try and promote humanity and remembering that these patients were actually not just physiology problems, but they were people. One of the things we did was we had a program called Meet My Loved One, where someone from the team would call the patient's family and ask some questions, some details, and get a photo. And we would post them outside the room, so personal details. I always remember one where a daughter, we would ask for tips. So what can we do to help care for your loved one? Do you have any tips? And this one daughter said, please make sure you put socks on my dad's feet because his feet are always cold. There was another one, and this was a man who was from another country, did not have any family here, was working to support his family. So we actually talked to his roommate, and his roommate said, may God bless you. Please take good care of this man. He is a good man. Unfortunately, both of these patients did not make it and died from COVID. The physical isolation that patients and caregivers experienced in the hospital was, of course, also experienced by families. We had families who would go to the parking lot and stand out and look across to the ICU. One side of the ICU faces the parking lot. And so some families could actually look into the room through the glass and catch a glimpse of their loved one. I always remember another patient, he was on the other side of the ICU where you couldn't look in room 28. He was very sick with COVID. He had some other medical issues as well. He also had a very large, devoted, loving family who was profoundly distressed by not being able to be with him. And so what they did, they wanted to be as close as they could. So they set up camp next to the shell sculpture next to the health learning building, which is right across from the hospital. I think most of you probably know where I mean. And they were camped out there every day, starting 9 o'clock in the morning until late at night. And this is in July in Austin, so pretty hot outside. They had a cooler with cold drinks and an umbrella, but they were there, and they said they felt better knowing they were as close as they could be to their loved one. I would go by them at night and would stop and give them an update. It was actually kind of, in some ways, nice for me because I was able to actually see them in person and talk to them. They told me that there was a sympathetic security guard who would let them into a nearby building to use a restroom during the day. But every day I also dreaded walking past them. It broke my heart a little bit every day because I knew that this patient was not going to make it. The other challenge that we have faced in the past year is also not a new problem, and one that we should have been ready for because we have been avoiding it forever. The inequities we see in medicine are profound. I think that we in medicine feel that we are above being racist or sexist or biased because we're good people, right? We want to help people. We want to get them better. Good people go into medicine. We sacrifice a lot. But we have study after study showing us that we in medicine are not immune from the structural inequities that plague our society, our country, and our world. I'll give you two brief examples that were really profound for me and have impacted the way that I care for patients. One is a study on children with appendicitis. So if your child has appendicitis, they come to the emergency room and then they go to the operating room. Maybe they get antibiotics. We have some new ways we treat it, but they're often in pain. And so we give them a small dose of a powerful pain medicine so that they're more comfortable. This is standard of care. If you have a child, 8-year-old child with appendicitis in the emergency room, and your child is white, your child is 3 times more likely to get the appropriate pain medication than a child who is Black. If you come to the emergency department with chest pain and you are found to be having a heart attack, the standard of care is to go to the cardiac catheterization lab, and we will treat you there. If you are a white man, you are much more likely than a Black man to go to the cardiac catheterization lab. If you're a Black man, you're much more likely to go than a white woman. And if you're a white woman, you're much more likely to go than a Black woman. So what do we take from this? I've thought a lot about this and how do I do a better job of caring for my patients? I'm not immune from these inequities and these biases. I think first we need to acknowledge them. It's something I try and remember every day, and we discuss in our rounds as a team. But that is not nearly enough, and we need to address this not just on an individual level, but on a structural, institutional level. I hope as students you will help lead and push medicine forward in diminishing and ultimately eliminating these profound inequities and biases. The dual challenge of the past year and a half, COVID-19 and the increasing recognition of health inequities, fill me with hope for our profession. Science is real and strong. The development of vaccination for COVID-19 has been nothing short of amazing and a miracle. That we were able to develop the most effective vaccine in history and distribute it under a year is remarkable and unprecedented. Using the AIDS analogy, it took science at least 3 years to figure out what was causing, there was actually a virus that caused AIDS. Of course, we had made remarkable advances in science that have helped that, but it has really impacted COVID-19 in such a profound and positive way. No matter what you encounter in your medical future, your training at Dell Medical School will prepare you. I have supreme faith in our ability to train you as a physician. And that's because medical training at its core has not changed that much. So yes, we have simulation labs and dummies that talk back to you, and we have electronic health records, we have robots, but at the end of the day, artificial intelligence cannot sit down as a physician with a person who is a patient in front of them and talk to them, get a history, examine them, decide how to treat them with their consent and with discussion and operate on them. Nothing will take the place of the physician. So I think that in this fundamental way, your training will not be that different from the training that Dr. Tony Fauci had 50 years ago. The core skills that make a physician, the special privileges and responsibilities remain sacred and passed down from one generation of physicians to the next. You will be challenged and you will be humbled by medicine, by physiology, by patients, by unexpected declines that come out of the blue, and also unanticipated remarkable recoveries. I hope you can take time to remember your privilege in being part of this sacred tradition and earn the trust of your patients that they so deserve. Welcome to medicine. I look forward to all of your futures.
Thank you, Clarissa, and I'm glad you're watching. My name is Steve Smith. I'm the Associate Dean for Student Affairs at Dell Medical School and highly honored to be in that role and to be here this evening. I do want to say a few words tonight, like several others have, that are directed to the class. This is a unique white coat ceremony. Most often, as you know, these occur shortly after you matriculate, orient, and start. But COVID, is anybody but me tired of those two words? But COVID. There are several consequences for this delay in your ceremony. Some, like being able to do it in person, are very much planned, intentional, and celebrated. But some are serendipitous. There's a unique poignancy to this timing in that you, this class, will start seeing patients full-time Tuesday. That's coming quick. Most of you are feeling both very excited and very nervous about caring for patients in just a few days. Some are asking yourself, am I ready for this? At orientation, I told you that we really did read your application carefully, and our admissions committee really did know what they were doing when they accepted you, because they were confident you could join the mission of Dell Medical School and revolutionize how people get and stay healthy. I want to repeat that now. You are ready. You're not ready for everything, but you're ready to learn in the clinics with real patients that need and deserve real expertise with real compassion. There's one more impact of timing of this ceremony in this class, and that is that in some very unique ways, this class has learned and demonstrated support for one another. Much of your support for one another has been highly virtual, but at times it was also very personal and very practical. I know that many of you delivered groceries to classmates and others that were iced in. I know that many of you opened your homes to provide warmth and shelter to classmates that didn't have power. You have excelled in supporting each other in very practical ways, and I'm very proud of you for that. But I also think it gives you a unique bonding that I hope gives you an advantage as you enter the clerkships together. And despite the fear and anxiety that you feel, and coupled with the anxiety and the excitement, I want to say again, you are ready. Thank you. Today we get to observe these students officially don their white coats. In the years to come, they'll wear these coats during patient encounters as a way of identifying themselves as members of the noble tradition of medicine. Each coat was provided by the Travis County Medical Society and has a lapel pin provided by the Arnold P. Gold Foundation to serve as a reminder of the importance of compassionate and humanistic care. Our innovative curriculum places students in a small group of peers with one clinical skills mentor. These mentors have been working with these students, preparing them for their first clinical encounters. These docs groups stay together for the entire 4 years. And I believe that these purposeful relationships built in these groups will be a source of pride, connection, and identity for students throughout their careers. It is particularly fitting in our ceremony then that students are cloaked by their mentor and are cloaked in groups with their docs group. Today, as we proceed, each group will rise and come forward, and the first group, you can go ahead, so that each group can be honored. When the student reaches the platform, I will announce the name. The student will then proceed across the platform to where their docs mentor will cloak them with their white coat. Then they will be greeted by Dean Johnston, and then they will reassemble on the other side of the platform. So it's my honor to introduce the class of 2024. Dr. Pandian's group. Edie Adams. Yael Booten. Sophia Garretta. Faraz Jaffrey. Saima Khan. Dr. Mariquin's group. Daniel R. Bamrick Fernandez. Nikita Chaudhry. Catherine Goodfellow. Courtney Matthews. Brooke Curlin Upchurch. Dr. Avashia's group. Michelle Bach. Alexander Chu. Maya Eldon. Jensen Gary. Hilmar Ortega. Sanjana Ravi. Dr. Miller's group. Kanan Hancock. Alma Rosa Rivera. Felicia Cynthia Sani. David Wang. Shoshana Tsung. Dr. Bedoya's group. Chris Blanton. Rabab Isa. Amanda Michelle Hustiz. Vishal Patel. Caroline Walsh. Dr. Manja's group. Emily McCauley. Jaime Abram Morales. Ananya Roy. Yosha Singh. Josh Whitcup. Dr. Salazar's group. Aaron Kovar. Manvi Muthyala. Joseph Stautner. Madison Turzo. Olivia Viscuso. Dr. Singh's group. Rachel Dom. Hannah Rushdan. Veronica Remmert. John Saxton. John Wagner. Dr. Moreno's group. Shreya Ahuja. Nirupuma Ancha. Holly Rebecca Langley. Scott Spivey. Michael T. Dr. Taylor's group. Jared Moon. Peter Rahman. Jessica Turner. Munachimso Uzadike. Georgia Williams. Ladies and gentlemen, it's my honor to present to you the Dell Medical School Class of 2024. Please join me. It's now my honor to welcome Dr. Nancy Thorne Foster, President of the Travis County Medical Society, to the podium to lead our class in the Dell Medical School oath.
Thank you very much, Dr. Smith. Class of 2024, it is my honor to lead you in the recitation of the Dell Medical School Hippocratic Oath. I also invite all clinicians to join our students. I swear to fulfill, to the best of my ability and judgment, this pledge. I will respect the autonomy, dignity, and privacy of my patients. I will practice my profession with conscience and in accordance with best medical practice. I will remember that there is an art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the benefits of surgery and medications. I will not permit bias, prejudice, or other societal constraints to impact my responsibility to my patients. And I will be vigilant in addressing health inequities. I will avoid the traps of overtreatment and advocate for those without access. I will always put patients and their families ahead of personal gain. I will prevent disease and promote health. I will advance health in my community beyond the walls of the clinic and the hospital. I will collaborate with all members of the healthcare team to provide comprehensive care to my patients and to the community. I will recognize the limits of my knowledge and skill and seek the help of others when needed. I will work to improve the quality and the safety of the healthcare system. Through innovation, collaborative leadership, and teamwork. I will attend to my own health, well-being, and abilities. in order to provide care of the highest standard. If I do not violate this oath, I will live honored, knowing that I have returned to society the great investment and trust that it has placed in me. Congratulations and welcome to your clinical years.
Thank you, Dr. Foster. So Nancy Foster and I have had the privilege of running basically Zoom conference calls, but these gigantic calls for the physician community in Austin, educating folks about COVID through the pandemic. And that's been a great honor to do that with you, and I think important for our community. This is an amazing class. And it's time for us to celebrate. We've had a lot of, seriousness tonight, and it's well-deserved given all that we've been through together with COVID. But just, look at these guys and all that they've done. Think about what they've achieved to get here. It is really hard to get through pre-medical curriculum. It's really hard to do as well as these folks did. And then beyond that, to achieve things out of the classroom that made them special enough that we found each other. And I would say it is about us finding each other. It is almost impossible to get into Dell Medical School, which really, one in 100 gets in. An amazing, it says an amazing amount about the people that we have in front of us today. You guys are just getting started. You should be really proud of where you've gotten so far. We're proud to have you here with us. But you do have a little farther to go. The clinical, I would say though, you did the hardest year already. That first year, and we made it so much harder for you because of COVID, you couldn't even, see each other, take care of each other, do Frisbee Friday, which is, all these things that the other students have done to sort of blow off steam. So now you'll be able to do all that. This is a lot of fun, what you're about to do next. This is where you become, real pseudo-doctors. And wearing the coats gives you that, that privilege. So I want this to be a real celebration for you all. Look back, see all that you've done. You've got challenges ahead of you. It's not easy, but you have already achieved so much. Give yourself a break. You don't know everything. No matter how well we teach, we don't get all the facts in there, and you got to see patients to really learn. So be ready for the challenges ahead of you. But you are, just as Steve said, so ready. It's going to be fun. It's going to be a challenge. So wear these white coats proudly, but remember they can also separate you from your patients and also from other healthcare providers who are not doctors. So wear it also humbly. It does come with substantial responsibilities, just as your oath that you just took says, and as our speaker said earlier. And those privileges are really where we derive the greatest satisfaction in this profession. It's such a privilege to be able to be a part of a profession that's at the center of healing, at the center of responding to the community in disasters like we just experienced. So much better to be in the middle, to be important, to be relevant, to make a difference than it is to feel like you're on the sidelines. So congratulations on joining that today, symbolically through this coat. We'll be back again for diplomas where it's even more weighty in terms of what you can do. But this is a really important point, and let's all celebrate together tonight. So thank you all for coming tonight, and thank you all, classes. There are some refreshments. We are done, so enjoy the refreshments. Please celebrate. They're out back, right? Are they supposed to go out?